So I've just found out that another friend of mine has actually left full-time medicine, and I kind of just want to get something off my chest. It's debrief time. And I think this doesn't really go out to doctors, because I think most doctors will be able to relate to this. But if you're a non-medical person and you're probably thinking, why would someone who trained all those years to become a doctor actually leave? Hopefully this will shed some light on it. So here's the thing. I think there's very few cases where people actually don't like the practice of medicine. Like, for those people, it's very clear cut. Often they start medical school and they're like, you know what, I'm just not quite clicking with this. They probably leave early into medical school. And those people, fair enough, they just don't like being doctors for whatever reason. But I know personally so many doctors who are literally itching to leave full-time medicine, or they've already done it. And it's quite a disproportionate amount to people in other careers that I know about. And if you listen to why they've left medicine, especially if, you know, they made a video about it or something, just listen to why they've actually said it. They've never said, I hate practicing medicine. It's more to do with the role of the doctor, especially in the UK. That's what we can talk about. And oftentimes it's the system and it's the little things that make us feel like infantilized or disrespected, or feel like we're working back in the Stone Ages or something. And like, I'm trying to help people, I'm trying to save people's lives in a hospital. Why is there nowhere to sit down? Why is my doctor's office 2 meters by 2 meters with 6 or 7 people crammed in? True story. And there's been times where I'm just like, why am I in this position? And I'll give you some examples. Like, one of the most common situations is when you're applying for leave for a big event. Let's say, for example, it's your wedding day or it's your brother's wedding day, and you get all this pushback about whether or not you should be able to take leave on that day because you might be short-staffed. It shouldn't be like that. It should be, it's a life-changing event. If I tell you in advance to actually have that day off, you should be able to find someone to cover me. It's not like healthcare is a field where they find it very difficult to find people covering last minute. They're used to it. And so I think for many people, it's almost like a wake-up call, or the straw that broke the camel's back. Like, imagine you've been working all these years, you've racked up all this debt, then you start on a fairly uncompetitive wage. The last thing you want to hear is that when the biggest day of your life is coming about, you now have to fight to get the day off. It's not feeling respected by a system. But what really annoys me is that there have been seriously good doctors, really talented people that I have personally worked with. I admired them, and to see them leave medicine just feels like such a big loss, when it could have possibly been avoided if the working environment and job as a whole was improved. I just want you to know that, like, a lot of the time it's about feeling respected. So hopefully that sheds a little bit more light on why I think people are leaving, and this is, you know, from their own mouths. But yeah, that's my rant for today. See you the next one.